Good evening, everybody. I'll be talking on DOTS, documenting of trauma with SmartScope kit. As we all know, eye represents 0.27% of the total body surface and still gets to be affected, the third most affected in trauma and injury. And the visual mobility is high, especially in hires in developing countries, and about 1.6 million go blind due to ocular trauma. So that is why medical history is very important. The ocular examination also is very important, and management is important during this ocular injury. And documentation becomes very important for the treatment that we are going to give and for counseling the patient, because that worry, and then teaching and also medical legally. So as we all know, paper-based medical records are difficult to be, or it's disorganized, illegible, tattered, confused, and EMR takes time consuming and it's very expensive. So not everybody can actually afford the EMR, and it's already given in papers that documentation is very important, and photo documentation is even more important in a trauma case. So as we know in our clinic, it is very difficult for us to do photo documentation due to expensive. Accessibility is not there, availability, bulky, portability and handiness, it's not possible. And not everybody can actually afford this, and that's where our SmartScope kit comes in. So this is basically a innovative kit that we have done, in which we have a visual acuity, a smartphone visual acuity, that's an eye handbook, which gives us to check the visual acuity. It has pinhole occluders and plus 10D trial frame. And then there are investigations such as torch, BP apparatus, pulse oximeter, dilatation drops, and other investigation modalities, as you can see here: frozen strip, forceps, sterile 26 gauge needle, cotton swab, etc. And these are all things which you can get in the OPD itself. Then comes our innovations. One is the iverter, which helps us evert the eyelid without touching. And then universal eye speculum over here. This is the anti-segment photography with intraocular lens. Basically, we use a chart paper, and then we use a double-sided tape within it. And once this is done, we use a 15 diopter IOL between the hole created with the paper puncher. So once this is done, we attach this to the smartphone, and then it becomes a macro photography device. So once this is done, we can actually take images of the anti-segment without a slit lamp. So anybody who doesn't have a slit lamp with a photography module, they can use this. And these are all the images which we have taken without a slit lamp. So going ahead with the documentation of anti-segment, we have tonometry in this. And then we have the ASPE gonio, where we use a 6 diopter IOL instead of the 15 diopter IOL, and you can use it with the gonio lens to take images of the angle also. Then we have the IOL scope. This is basically just for a mention that we can use 4 30 diopter IOLs all together, combined together, and then you can use this for assessing of fungal hyphae and parasites using this. This is just for a mention. And then we have Scooby-Doo. That's a cobalt blue filtering device. Over here you can see how we attached a blue filter to the ASPE device which we already have, and this can be used to take blue photography. Over here you can see how beautifully a CDLS positive can be recorded without a slit lamp. It becomes very easy and handy in our clinic if you don't have a imaging device in our clinic. And then going for the posterior segment, we have the trash to treasure red cam, where we use a hand sanitizer bottle and cut the bottom of the bottle in such a manner that you can actually fit the 20D condensing lens into it. And the other side is attached with the smartphone. And with this, you can actually start taking images of the posterior segment. Here are a few of the images that has been taken: choroidal rupture, macular hole, foreign bodies. So these make up the whole SmartScope kit. So with this, the results over here, you can see cornea and retina were more affected in the trauma cases which we had over here. Basically, it's an effective kit for documentation of trauma-related findings in places where photo documentation was not done before. It helps in on-spot counseling of the patients, and it helps the doctor in medical legal cases also. It's a new age, innovative, do-it-yourself comprehensive kit which can image findings ranging from anterior to posterior segment, and it is a very efficacious and alternate to the conventional instruments which we have right now. Thank you.
Fantastic. Very nice, innovative things. Very interesting also. Every ophthalmologist should have it. A round of applause. Really an award-winning one.